Okay, so the next case is again a case of shortness of breath, but this would be acute pulmonary edema due to heart failure. The patient will present with shortness of breath. The patient will be having the shortness of breath, but you will know that the patient is already diagnosed case of heart failure, or the patient has recently had myocardial infarction 2 or 3 months ago, 2 or 3 weeks ago. The patient is getting treated for heart failure. The patient has some other heart conditions going on. So there will be some history which will lead you toward this particular diagnosis. How to manage it? Again, the same A to E approach. You will do everything, monitor low saturation, give the NRB whenever needed or not, whenever will not be needed. In this case, you will find bilateral crackles on the examination of the chest. Bilateral crackles, what do we mean by here is fine crackles, which will be because of the fluid buildup. Okay, so you will continue with oxygen. You know that there is fluid buildup. What do you need to do here is you need to give some medication for it. But you cannot give medication until you've secured IV access, which you will do in the circulation part. So you'll quickly move through this. You will go to the heart, you quickly auscultate the heart, you will check the blood pressure. It can be high, it can be low. It will not be too low because they would not be putting you in a condition where you will have to choose whether to give fluids or not because it's a heart failure. We do have some fluid restriction in this case. So the blood pressure they will be giving you like in a normal range, or it might be high. It will not be too low. Anyway, you will pass the IV access, and after passing IV access, you will take the blood samples out. In this case, you will take all the blood samples again, but what particular blood samples are you going to take in heart failure? Pro-BNP markers. Okay, this is an important one. Please write that down. Pro-BNP markers is a specific marker for heart failure that you will be sending. And yes, then after sending the blood levels, you will be giving IV furosemide, just 40 milligrams slow IV and GTN infusion. So IV furosemide is basically the management for this case. The patient has fluid buildup in his lungs. The patient is having pulmonary edema due to heart failure. And that's why he's having shortness of breath. So you have to give IV furosemide 40 milligram IV slow. But since the patient is having heart failure, and it is because of some underlying heart disease, you can give glycerol trinitrate as well, but that depends on the blood pressure of the patient. If the blood pressure says that the systolic blood pressure is greater than 100, then you will give this infusion. Otherwise, you can skip it. If the patient's blood pressure is, let's say, 90/60, then you will not give this infusion because this also reduces the blood pressure. So we don't want the patient to go into hypotension. If the systolic blood pressure is greater than 100, then you can start with the GTN infusion, otherwise skip it. That's why it's important to keep reassessing the patient. That's why it's important to manage the patient, not the case, because every patient varies and every case might vary depending on what you get in the exam. Disability, you check for all the things, you check for the temperature, everything else. Exposure, you do everything like we did before. How we'll do the test part here is 68-year-old male presented with acute shortness of breath, has a history of ischemic heart disease before. On presentation, patient had a low saturation, and I could hear bilateral crackles on the basis of the lungs. Plus, patient's JVP was raised, and yeah, so I'm suspecting this might be pulmonary edema due to heart failure. I've given my patient oxygen. I've given my patient IV furosemide and GTN, and I've sent his blood for the samples. Chest X-ray is pending. I've ordered a 12-lead ECG, and now I would like to involve my seniors to come and reassess my patient. We will keep the patient here. We'll admit the patient here for optimization, and depending on his condition, we will consider CPAP, BiPAP, or ICU. That's it. This was it about the whole heart failure scenario. Let me know if you have any questions, and I can answer them in the chat box before starting the next case.